Hi, my name is Shaun Harrington. I am a junior at UW-Milwaukee majoring in biochemistry. And today I'm going to be discussing how we are currently using biochemistry to aid in the treatment of asthma. First, it's important to remember how serious asthma is. Over 339 million people worldwide are affected by it, and the damage it can cause can range from small health complications to even fatal ones. Now, I'm sure everyone is at least a little familiar with asthma, but I think it's crucial to really understand its relation to inflammation. Inflammation is an essential defense mechanism that can be used by our bodies to help with infection or injury. With asthma, the body tends to overreact in a way that leads to unnecessary swelling and obstruction of your airway, and that leads to difficulty of breathing. And with that being said, I think we can dive into the research that's being done to help combat these chronic inflammatory processes. So, in our research, the protein TSPO is our main focus. Essentially, TSPO can be commonly found in the brain and lungs, and it's directly related to inflammation. This means that when TSPO levels increase, so does the inflammatory response. And so, to tackle the inflammation caused by asthma, we want to target this protein. And to do that, we need something called a ligand. So, ligand is a molecule that binds to a protein. And in this case, the protein is TSPO. So, if we can create a ligand that selectively chooses TSPO in the lungs, we may be able to modulate or control the inflammatory processes that happen there. However, we have these proteins in our brain and lungs, so first we must create a ligand that can't pass through the blood brain barrier and therefore can't bind to TSPO in the brain. And this will allow us to selectively bind to TSPO in the lungs because that is where the problem is happening. So, my involvement in this research has been more in the beginning stages involving organic chemistry. So far, we've been able to identify the most efficient system for creating these new compounds or ligands. And we have used other aspects of biochemistry, such as liquid chromatography, mass spectrometry, and NMR spectroscopy, to help purify and identify these compounds. Numerous compounds have been synthesized and tested. We've had successes and challenges, and you can see as our yields have been ranging from low to high. But in conclusion, we are hoping to create compounds or ligands that bind specifically to TSPO. And I think by looking closer at biochemical processes in our body, we can further develop therapeutic methods to potentially help the lives of patients who are suffering from these chronic lung diseases such as asthma. Thank you.